Welcome to my vlog 3, coaching assessment. Today's session is with Dan, who came to me with chronic right knee discomfort and inconsistent training habits impacting both motivation and performance. We created a recovery and performance plan focused on joint restrictions and technique refinement. This session uses internal and external cues, both explicit and implicit, to build a feedback loop for efficient movement. Using dynamical systems theory, I've structured constraint-led tasks and match intensity to Dan's capacity with the RPE scale. He's now warming up on the air bike before we begin our lower body work. We began by prepping knee tissues as tight quads raise injury risk. Whitworth et al. 2001. I used external cues to shape technique and internal feedback post-set to refine control. Wolf 2013. Since back squats previously caused pain, landmine squats replaced them, reducing joint stress and promoting posterior loading. Collins et al. 2021. Schrob and Powers 2024. Dan brought 5 to 6 years of gym and cycling experience but lacked structured progression. What Cushion et al. 2006 and Lyle 2002 describe as uncoached training without adapted feedback. He reported medial knee pain and tested with limited dorsiflexion, likely affecting joint loading. This matches findings linking ankle restrictions with compensatory patterns. Belgengi et al. 2016, Dill et al. 2014, Lima et al. 2018, Macram et al. 2012, which shaped our prep and loading approach. The pain had lingered over a year, impacting his mindset and consistency. Dan mentioned low confidence, typical of what we see in injury-related literature. Crossman 1997, Dishman 1982, Duda et al. 1989, Forsdyke et al. 2016. Now we are 3 months in. This assessment reflects where he currently stands. From the start, I emphasised that my coaching method is not a one-size-fits-all approach, and instead my philosophy leans towards consistency, variability and patience. His program is constraint-driven and tailored to support stable attractive states through interaction with task and environment. With external cueing and video feedback, knowledge of performance and results, we've supported implicit learning and self-organisation. Cushion et al. 2006, Lyle 2002, Mordinger et al. 2022. All decisions stem from Dan's needs analysis. His goals, patterns and training context shape the program. That's the essence of strength and conditioning: individualization, specificity and progressive overload. Bangsbo's 2006, Bomper and Half 2009. Starting this prep block with leg extensions, a key movement for Dan due to inner medial knee discomfort. Here's how I cue it. Swing your lower legs forward like a cat flap, smooth and snappy until it flattens like a table. Hold briefly, then shut it down under control. That keeps the focus external, simple, clear and effective. No overthinking, just clean reps with intent. This drill loads the quads and patella tendon without stressing the joint. It primes the extensor chain, reinforces medial knee stability and builds tolerance safely. Whitworth et al. 2001 supports this limited quadriceps flexibility, raises patella tendinopathy risk. Rather than beginning with squats, we are prepping the knee with safer mechanics. Dan rated set 3 as an RPE 6 moderate effort, ideal for this phase. We cap intensity to avoid pre-fatigue and reserve energy for compound lifts. It's about priming tissue, not grinding. RPE reflects intrinsic, internal and explicit feedback. He gauges how it feels, then gives his rating as we apply and use this feedback immediately. Cueing stays external. Drive the legs up like a cat flap, flatten to a table surface, then shut it back down. That directs his focus to the outcome. After we use RPE for internal reflection, muscle activation, feel and compensation. This mirrors attentional focus theory. External cues guide execution. Internal feedback refines it post-set. Wolf 2013. My strategy integrates both, bridged by RPE. Moving into exercise 2, hip thrusts, a staple for posterior chain development and key for glute activation, trunk stiffness and lower limb positioning. With Dan's medial knee discomfort, this shifts low posteriorly while still training hip extension. I've used the constraints-led approach, adding a resistance band just below the knees to cue active hip abduction and counter valgus during the concentric phase. This is especially relevant for knee stability under load. Belgengi et al. 2016, Dill et al. 2014, Lima et al. 2018, Macram et al. 2012. Before Dan lifts, I cue take a deep breath and abdominal brace to build intra-abdominal pressure and reduce lumbar extension. The hip hinge should start from the crease at the front of the hips, referring to both bony parts of either side of the anterior superior iliac spine, highlighted by the diagram figure where the hip crease line is just underneath the centre of mass referenced by the red line. I adjust his foot positioning by moving heels proximal, toes angle slightly back for vertical shins at peak extension for optimal engagement. Then externally cueing. Drive your hips up to the ceiling until your groin, thighs and belly are flat like a tabletop, maintaining the trunk solid like a stiff plank, and rock off the edge of the bench just below the shoulder blades. This draws from Cushion et al. 2006 and Lyle 2002. External focus promotes automaticity. Between sets, I showed Dan split screen clips of performance and results feedback. This kind of feedback is backed by Crossman 1997, Forsdyke et al. 2016 and Mordinger et al. 2022, who all highlight how it helps drive motivation, confidence and skill refinement. After this refined set, Dan gives his RPE an 8 and identifies where he felt it. In reflection, I ask if he felt the glutes dominated. If not, were there slight overcompensations within the lower back or quads? This integrates internal and external feedback. It's not just glute strength, it's quality, constraint-driven movement and feedback loop refinement. Bangsbo 2006, Bomper and Half 2009. Moving on to exercise 3, knee to wall. This drill used a wedge under Dan's foot to enhance ankle dorsiflexion. The toes are positioned on the thickest part of the wedge, tilted slightly downhill. This preloads the ankle into dorsiflexion and increases the challenge of touching the wall without lifting the heel, reducing compensation and isolating ankle mobility. Lima et al. 2018. Improving ankle dorsiflexion is crucial for squat mechanics and reducing dynamic knee valgus. Dan previously showed ankle dorsiflexion limitations, so he integrated this drill to improve his knee tracking. Lima et al. 2018 and Macram et al. 2012 both highlight how dorsiflexion restrictions contribute to poor frontal plane control and compensatory patterns. This mobility drill also sets up better force transfer during triple extension and reduces potential aggravation of Dan's medial knee discomfort. It functions as a primer before compound lifts, helping reinforce safer mechanics without triggering symptoms. Belgen G et al. 2016. The wedge here also acts as a task constraint, altering the environment to drive the desired motor pattern. Instead of cueing the ankle directly, we let the constraint shape the movement. This fits within the constraints-led approach and dynamical systems theory. Movement emerges from interactions between task, environment and the individual. Cushion et al. 2006, Lyle 2002. Over time, that repetition under load builds a more functional attractive state. Stable, repeatable control at the ankle under load. Moving on to the fourth and final exercise, here with me cueing and demonstrating key positions during the landmine squat. I use both external and internal cues to facilitate implicit learning. Internally, I cue Dan to not round the spine, especially during the descent, and to form the crease at the front of the hips, again referring to both bony parts of either side of the anterior superior iliac spine, highlighted via the diagram figure where the hip crease line is just underneath the centre of mass, referenced by the red line. This is where we want the hip fold to originate. I also cue them to imagine sitting down into an invisible chair with the knees tracking the toes throughout the movement. To maintain trunk stability, we focused on taking a deep diaphragmatic breath and bracing hard, activating every trunk muscle before initiating the squat. At the bottom, we emphasise keeping the spine neutral and the torso as upright as possible, encouraging upper back tension through the internal cue, retract your shoulder blades, and externally with imagine pinching on a pencil between your shoulder blades to avoid thoracic rounding. As back squats had previously caused Dan discomfort around the intermedial aspect of his right knee, we replaced them with landmine squats, an effective alternative that allows us to load the lower body while respecting joint integrity. The anterior load of the landmine promotes a natural upright posture and more hip dominant squat mechanics, reducing stress through the knees. Dan reported no discomfort during or after this variation, which aligns with findings by Collins et al. 2021 and Schraub and Powers 2024, who highlighted that landmine squats reduce anterior knee shear, quadriceps dominance and promote posterior force production. To reinforce the mechanics, I implemented two constraint-led approaches. First, I used heel wedges to increase tibial inclination and ankle dorsiflexion, improving squat depth and reducing compensation. Second, I placed a resistance band just below the knees, encouraging hip abduction and preventing dynamic valgus through the both descent into triple flexion and ascent into triple extension. These environmental constraints shape Dan's technique automatically without needing to over-instruct, demonstrating the practical application of constraints-led approach. This is rooted in dynamical systems theory, which views movement as an emergent behaviour influenced by the interaction of the individual, the task and the environment. By adjusting task constraints like the bar position, wedge angle and resistance band tension, we can guide athletes' system toward more stable and efficient attractive states, repeatable and optimal movement patterns under load. Dan completed 3 sets of the landmine squat, reporting set 1, 3 out of 10, set 2, 5 out of 10 and set 3, 8 out of 10. This steady progression was ideal, stimulating adaptation while remaining controlled. We focused on motor skill acquisition, not load. As the landmine squat was new for Dan, RPE helped manage fatigue and avoid aggravating his knee. Video feedback supported both knowledge of performance, joint control and depth, and knowledge of results, rep quality. I laid explicit and implicit cues, allowing learning to emerge through task constraints. Cues included external, drive hips to the ceiling, stay flat like a tabletop. Internal, retract your shoulder blades to stay upright. Crossman 1997, Forsdyke et al. 2016, Wolf 2013. This session showed how DST, cueing and feedback strategies build movement quality without overcoaching. Bangsbo 2006, Bomper and Half 2009. Reflecting on this session with Dan, one coaching behaviour I want to improve is my tendency to be overly cautious. Having gone through serious injuries myself like ACL reconstruction and spinal disc damage, I understand how critical it is to avoid setbacks. That's why I coach around consistency, variability, and patience, often choosing to underload rather than risk overreaching. Dishman, 1982. But I've recognised this can sometimes hold athletes back, slowing their adaptations when they are actually ready to progress. Going forward, I want to better balance safety with challenge, trusting the athlete's signals and being more confident in pushing load when appropriate. Coaching isn't just about protecting athletes, it's about guiding them through plateaus with trust, timely challenge, and feedback. That's the behaviour I'm working to refine.